my name is Madeline Gomez, and this is my mom, and we are from the Gambia. First, when we got here, I was in pretty bad shape. We had to do a biopsy, a lymph node excisional biopsy, which we did. And when we did, it suggested a lymphoproliferative disease, which means basically cancer. And after that, we had to do a PET scan, which revealed, of course, that there was cancer in my lungs and in my bones. And at that point, it was stage 4B.
Hello. So I'm Dr. Parveen Jain. I'm a medical oncologist at Aakash Healthcare Super Speciality Hospital, Dwarka. So I would like to tell you about a patient, 30 years old, pediatrician by profession. Her name is Madeline. So she came to us in early 2025 with complaints of shortness of breath, with complaints of skin rash. And she was initially treated for tuberculosis. So I think which was a misdiagnosis. So it was not tuberculosis because she had a lot of lymphadenopathies and she was misdiagnosed as tuberculosis and was treated for that. But she did not get any relief out of it. So she went to some other country and there she was diagnosed to have autoimmune disease. Again, steroid was given, no relief in any of the symptoms. She started to have fever. So now the main complaints were shortness of breath, fever, rash. So we had done a biopsy from the lymph node and which turned out to be a Hodgkin lymphoma. So now this Hodgkin lymphoma, it's a kind of cancer which arises from the lymph nodes. Basically, it leads to proliferation of these atypical lymphocytes. These eventually lead to development of B symptoms in terms of fever, weight loss, and night sweats. So, and it is seen that these patients who have B symptom, they have poor prognosis as compared to those without B symptoms. And if we talk about the extranodal involvement, she had a lot of bony disease. So there were bony lytic lesions throughout the body and there were lung lesions as well, apart from the infra and supradiaphragmatic lymph nodes.
My doctor was Dr. Parveen Jain. He's a very professional doctor, one of the best I have ever come across in this period that I have been sick. He is very empathetic. He has great communication skills and he just encourages you in so many ways. And I'm quite lucky to have met him. He recommended chemotherapy, which I was supposed to go through for 6 months. And he told me all the management plans that we were supposed to do. I went through the chemo for the 6 months, and now here we are. We have great news. I am all ready and fit to go home.
So the standard care of treatment for these patients, so they can be plain chemotherapy based regimes like ABVD regime, or there can be newer novel combinations. So like we combine an immunotherapy called nivolumab along with the chemotherapy, or we can combine an antibody drug conjugate like brentuximab vedotin along with the chemotherapy. So here we had gone ahead with the ABVD regime because of the cost constraints. So post 3 cycles, that means 3 months of therapy, she was in complete response. So her symptoms, they subsided in 15 days time approximately. She started feeling better. There was no fever. The breathlessness also became better and the rash was gone. So these were the kind of responses which were seen in this patient. And usually Hodgkin lymphoma, they respond beautifully to treatment.
So for me to be sitting here and saying this is a big testimony. I couldn't walk. I couldn't breathe properly. I couldn't sleep, eat. Yeah, even eating basic human functions that you would do as an adult, I couldn't do. It was terrible. Now I feel great. I'm happy. I'm not in pain. And I can go about my normal life.
One more thing which I would like to tell you here is, so she being an unmarried 30-year-old female who is a pediatrician by profession. So later on the fertility issues post chemotherapy, they always have tendency to develop. So we had discussed with this patient regarding the embryo preservation, oocyte preservation. So, but she was not willing for both of them because they were time-taking processes. And in view of the same, we had gone for ovarian function suppression with LHRH agonist, and finally she was treated with the chemotherapy along with ovarian function suppression. So this is also a very, very important aspect which we have to look for in lymphomas. So because most of the times it happens in the early age group where fertility it becomes a concern later on. So this patient is now going back to her country. So I think this is a very important case where 2 or 3 comorbidities they were acting against each other in terms of the treatment, and we had dealt with that, and now we have the result of a complete response in this patient. Thank you.